So, hi everybody, and welcome to our July Ambassador Briefing. Today, our special guest is Sarah Eggy, the principal and co-founder of Split Oak Strategies, and she will give us an update on everything going on Capitol Hill. And then when she is done, I will give a little bit of an update on advocacy opportunities that we have coming up. And then we'll have a chance for folks to ask any questions they like. So thank you everybody for joining us today. And then now I will turn the presentation over to Sarah.
Excellent. Thank you so much, Ben, for that wonderful introduction. It's so great to be with all the ambassadors here today. I have the great good fortune to work with Ben and the rest of the team members at the American Kidney Fund on a daily basis on issues of concern and interest to the kidney community. And I'm so delighted to be here. Ben, are we able to put up the slides so that everybody can see?
Yeah, I'm working on that right now.
Okay.
One moment.
Excellent. Well, I'll go ahead and get started. We won't let that slow us down. If we can just move straight to the next slide, that would be great. Excellent. So Ben asked me to join today to just give a little bit of a sense of, what to expect from Congress from the remainder of this year. I mean, it's hard to imagine that we're already almost at the end of July, almost 7 months into a new administration and a new Congress. And while, tuning into the news, you might have the perspective that not a lot is actually getting done and across the finish line up on Capitol Hill. There is actually going to be a flurry of activity in the remaining months. And thought it might be helpful to sort of walk through what some of those key items are, some of the provisions that are of interest to many in the kidney community, and really potential opportunities to advance some of our agenda items throughout the remainder of 2021. So if we just kind of start with this week, a rather historic agreement was reached yesterday between President Biden and bipartisan Senate leaders on a big infrastructure package. Many people refer to this as the bipartisan infrastructure deal or the bipartisan infrastructure framework. And it includes a number of elements that were in President Biden's American Jobs Plan, which is part of his sort of broader Build Back Better agenda. So the Senate's going to be working on that. We'll talk a little bit more about what's in that later in the presentation, but that's really going to be a lot of focus and attention up on Capitol Hill for the next couple of weeks. In addition, Congress is going to begin work next week on advancing the fiscal year 2022 budget resolution. And that's just a fancy way of saying their big budget blueprint that lays out their top line funding and revenue and deficit and debt levels for the coming year. And work on that will help line up another opportunity to advance through the reconciliation process. And we'll talk a little bit about what reconciliation means. And Congress is going to advance some of those components that were in the American Families Plan, which is another proposal that President Biden sent up. Congress also needs to make sure that the government is funded going into fiscal year 2022. So annual appropriations process is really getting underway. The House is passing this week the Labor, Health and Human Services Bill, which contains a number of provisions that are of interest to the kidney community. That's going to continue making its way through the process and probably signed into law later this year. And there is also another opportunity as part of that end of the year spending package to attach a number of bipartisan healthcare pieces of legislation that members of both parties have been working on throughout the year related to social determinants of health, health disparity and equity issues, telehealth, behavioral health, and pandemic preparedness for future pandemics. So we'll talk a little bit about that too. So if we can skip to the next slide. So just an important reminder. I know you all know how the last election turned out, but visually, I thought it was important to remind everybody that the majorities are extremely tight in both the House and the Senate. So there is really very little room for error when Democrats are working on legislation that they anticipate moving with only Democratic support. As you can see, they really only have, 4 vote margin in the House. In the Senate, there's no room for error. They're 50-50, and often the vice president has been called in to sort of break tie votes over the last couple of months. This is why you're seeing a big premium being placed on advancing legislation that is bipartisan in nature. And we're in a bit of an environment right now, in Congress where it really has been difficult for the two parties to come together to advance key priorities. That's why this bipartisan infrastructure package is so notable, because it's going to be very significant in terms of the total amount of dollars that are being spent. And it really represents a month-long negotiation between key Republicans and key Democrats, involved lots of, having to give up on some key priorities that either side had in order to reach a compromise. And I think is representative of, hopefully turning a new page in how Congress can work together on legislation. So if we can move to the next slide. So what is in this bipartisan infrastructure framework? First of all, it represents about $550 billion in new spending. There's also some reauthorizations of existing spending, but the new spending in the bill on top of what they had already anticipated including is $550 billion. A lot of that will go to new transportation priorities, including, biggest investment ever in public transit, biggest investment in passenger rail since Amtrak was created, a whole bunch of funding for replacement of bridges. We've got a lot of crumbling bridges in this country, as well as $264 billion for other infrastructure aside from roads, bridges, and transit. So things like clean drinking water and wastewater infrastructure, making sure that everybody in America, whether rural or urban, has access to high-speed internet, significant investment in broadband, significant investment in things like addressing the climate crisis and making sure that we've got, the ability to transmit clean energy and have infrastructure in place for electric vehicles, creating a 21st century electric grid. Those are the kinds of things that will be in this package. There are a number of offsets to help pay for some of the new spending. It does include a few health-related offsets. But the next step is the Senate is advancing to debate on the legislation this week. They're hoping to pass it by the end of next week. And then it will get sent over to the House of Representatives, where the hope is that they will pass that relatively quickly and get that signed into law. Another thing that happened this week in the House is that they advanced a number of the regular appropriations bills for this coming fiscal year, including the appropriations bill that includes funding for the Department of Health and Human Services. Thought I would just flag a couple of key things that are included in here of interest to the kidney community. First of all, big increase in funding for the new social determinants of health program at the CDC. So last year there was only about, I think, 3 million included for this new program. They've increased that significantly up to 150 million. And the hope is that that's really going to accelerate what communities are doing across this nation to address social determinants of health. $4.5 million for the CDC health promotion program regarding chronic kidney disease to help raise awareness of chronic kidney disease. 2.23 billion at the NIH for research on diabetes, digestive and kidney diseases. That's 105 million increase over what was included last year. So a lot of people are very excited to see that significant increase. So next steps for this bill, the Senate needs to take action on its version of the appropriations bill, and then we're going to have to resolve the disagreements between the two chambers. The expectation is that we're probably not going to see this get signed into law until sometime in December, and then those dollars will be put to good use by the federal agencies. The next thing that we are going to see a lot of attention focused on is the budget resolution. As I mentioned earlier, Congress needs to pass a big budget blueprint that outlines their spending and revenue priorities for this next fiscal year. And as part of this, Democrats are hoping to include significant components of the American Families Plan and the remaining components of the American Jobs Plan, and advance that through what is known as the reconciliation process. And reconciliation is just a fancy way of saying advancing budget legislation that only requires 50 votes. So typically in the Senate, you need 60 votes to do anything. When it comes to the budget resolution and the budget reconciliation process, you only need a simple majority. So it would allow Democrats to go it alone with the vice president breaking the tie to advance legislation. If we can move to the next slide. Budget resolutions, this is what will be, the Senate will be taking up late next week into the following week, really just include top line funding levels. They're limited in the amount of debate time. They're limited to 50 hours of debate, but any senator can offer an amendment on any topic they would like, and every amendment in which a senator wants a vote gets a vote. What's unique about the budget resolution, this budget blueprint, is that it's not actually signed into law. So the president never signs, a piece of paper that makes this a law. It's simply an agreement between the House and the Senate of the budget levels that they are going to adopt for the coming year. The Senate's expected to finish its work on their version of the budget resolution before they recess for August. And the House is expected to come back from their recess sometime later in August to adopt the same budget resolution. If we can move to the next slide. So the budget resolution process sets up the ability to move forward with budget reconciliation legislation. You may have read in the paper that there is talk about a $3.5 trillion package that's going to spend money on everything from paid family leave, free community college, to increasing spending for home and community-based services and expanding Medicare, dental, vision, and hearing benefits. All of those topics they're trying to shoehorn into this $3.5 trillion budget reconciliation bill. Budget reconciliation legislation is an interesting process that you've got to conform to certain rules that are enforced by the Senate parliamentarian and enforced in part by the chairman of the Senate Budget Committee, who in this case is Senator Bernie Sanders. And this is another time-limited budget vehicle where they only debate it for 20 hours, but senators can offer as many amendments as they would like. If we can move to the next slide. Some of the big healthcare related pieces that they are talking about including in this budget reconciliation legislation include things like adding a new dental, vision, and hearing benefit to the Medicare program, expanding home and community-based services so that more families can avail themselves via the Medicaid program for home and community-based services rather than an institutional setting. Extending the tax credit provisions that were in the American Rescue Plan, which made the tax benefits more generous, allowing more people to sign up for cheaper ACA market exchange plans. There's a lot of talk about moving forward with closing the Medicaid coverage gap. And what that really means is we have millions of citizens who live in states that have not yet expanded Medicaid. And unfortunately, those families are also not eligible for the subsidies, the tax credits, and the cost sharing reduction subsidies that are in the exchanges. This would essentially allow these families to buy into the exchanges and have really inexpensive health insurance coverage that's comprehensive. And then the other big investment Democrats are hoping to make is that in the Medicare program and the prescription drug benefit plan, they want to cap out-of-pocket costs. And they're still debating about exactly where they'll be able to set this out-of-pocket cap, but they want to ensure that seniors, when they fill their scripts at the pharmacy counter, have a cap on that out-of-pocket costs, and they are not going into substantial debt in order to be able to afford their prescription drugs. There's a lot of other kind of smaller provisions that Democrats are talking about including in this legislation that doesn't quite rise high enough to the level as of a major investment, but there are things like funding to expand the healthcare workforce, funding for behavioral health care, additional funding for pandemic preparedness that they are also talking about including in this big proposal as well. The expectation is that much of this bill will be paid for, and the offsets include things like raising taxes on corporations, raising taxes on higher income Americans with incomes above 400,000. They are talking about lowering prices for prescription drugs as a way to help pay for this legislation. And then they are also hoping to essentially take the economic growth that will result from this package, take credit for that as part of an offset to pay for this as well. You may have heard that drug pricing legislation is a very hot topic in both the House and the Senate right now, and there is active work underway to develop the drug pricing legislation that would be included in this reconciliation bill. Some of the things that they're talking about doing include requiring certain drugs to be negotiated in terms of price by the Secretary of Health and Human Services. We already talked a little bit about capping the out-of-pocket costs in Medicare Part D. That's definitely part. They're talking about passing point-of-sale rebates that are negotiated between drug manufacturers and pharmacy benefit manufacturers and passing that back to Medicare beneficiaries at the counter for products like insulin. They are talking about ensuring that drug manufacturers can't increase the price of their drugs more than the rate of inflation in any given year, or else they would be required to pay a rebate. They're also looking at ways to extend the drug price savings, not just to Medicare, but also to commercial health insurance as well, for those who are enrolled in employer-based insurance or who are buying on the exchanges. So we'll see if they're able to accomplish that goal. And then they are also trying to make sure that at the end of the day, they are protecting those companies that are truly, bringing new innovative treatments to the market by ensuring that the drug pricing legislation doesn't harm companies that are truly innovating. So one of the things I do want to just flag for everybody as we're, thinking about the budget reconciliation legislation that's moving forward, which is going to have lots of great healthcare related provisions in it. At the end of the day, those, health provisions are going to have to be, shoehorned into a package that is capped out at $3.5 trillion. And so that may mean that we see that some provisions are phased in over a period of years. They might not all start, either this year or 2022. We might also see some provisions sunsetted, which means that they may only be 2, 3, 4, or 5 years in duration, and Congress is going to have to come back in the future to extend some of those programs. So that those are some of the factors that senators and members of Congress will be debating in the coming weeks. Next slide, please. Just wanted to end my remarks to remind everybody that there are definitely, beyond the reconciliation bill, which is expected to be a piece of legislation that really only moves forward with Democratic support, all of the relevant healthcare committees in Congress are dual tracking. So they're kind of working on those items that will go in the reconciliation package, but they are continuing hearings and legislative markups on pieces of legislation that really have bipartisan support, and they're hoping to advance later this year. So some of the key topics that they're working on include legislation to better integrate behavioral health into primary care and ensure that there is sufficient funding both for behavioral health, but also substance use disorder treatment. There's also a lot of bipartisan interest in taking some of the telehealth flexibilities that were created during COVID in the Medicare and Medicaid programs and making those permanent so that patients can continue to see their doctors and get their health needs addressed via telehealth. So we may see, an extension of telehealth for at least 1 year while they decide what do we want to keep on a permanent basis. The topic of addressing social determinants of health remains a really key area of bipartisan interest, as is sort of the broader goal of addressing health disparities. And this is not just in urban areas, but also in rural areas. And there's a broad range of policies that members of Congress are looking at, but it includes everything from improving access to services, to ensuring that we have a workforce that really reflects the population, that we're recruiting, new physicians, new nurse practitioners, new physician assistants, the sort of broad gamut of professionals in the healthcare space who are from rural areas, who are of different, racial ethnicities and minorities, and really reflect the population that they're serving. So I think we're going to see more work on that. And then pandemic preparedness. There's a lot that I think COVID really exposed, that our public health infrastructure has been neglected for a long time. And so a real interest in making sure the public health labs are being invested in and sort of brought back up to, gold standard, making sure that we continue to fund community health workers, and making sure that we're collecting data in such a way that we have a better sense of, what are the emerging health threats? Are we collecting that data and making sure that we're looking at the broad demographic indicators, whether that's gender, race, ethnicity, what have you. So I think we can expect to see some legislation on that front later this year, as well as part of an end of the year omnibus appropriations bill. And Ben, I think I'm just going to pause there. I mean, we can talk a little bit about, some of the legislation that AKF is working on, and then I know the ambassadors are interested in, or wherever anybody would like to take the conversation.
Sure. Well, maybe this is a good chance to see if anybody has any questions about anything Sarah has discussed so far. You can put it in the chat, or you can just go ahead and ask now.
This is Stephanie. Can you hear me?
Yep.
Hi. My concern is with regard to health equity. When I travel, or when I did travel, the problem is from center to center. I went to a clinic, I went to a conference in Baltimore, and then to a clinic in Baltimore, and I piggybacked that on a visit to my brother in DC. I was unable to receive the same medications that I received at my clinic because they did not offer that. After 6 days, I cut my trip short and went home because I thought I was going to die or at least be hospitalized. So the problem is when you go from region to region, the medication offered is different. Through the KPAC, they sent us a list of substitutes that we could ask for, but they didn't offer that either. And then these clinics, I guess, were trying to bleed money out of me or my insurance by asking me to take blood tests. I already had blood tests and submitted blood tests. You can't go to another clinic without your clinic submitting all that information in advance. And this is why they told me they couldn't give me the medication. And that was just ridiculous. And also with regards to the beginning of your presentation, I sincerely appreciate all that you're doing, and especially that people don't have access to clean water. Thank you.
Thanks, Stephanie. Anyone else have any questions?
Yeah, Ben, this is Patrick. First of all, thank you for that presentation. Greatly appreciate it. One of the things that I wanted to bring up just as a point of clarification was for the social determinants of health. I was just wondering if anywhere in that piece of legislation they were talking about language barriers and anything dealing with health literacy when it comes to citizens that are on immigration status within the kidney community because of language barrier and immigration status. A lot of kidney patients aren't able to qualify for a kidney transplant unless they have the money up front to pay for it. So I think we're talking about an insurance issue. There are even some folks that I've come across on dialysis. Let's just take, for instance, if somebody's at home doing peritoneal dialysis, I run across several patients that actually thought they had a kidney transplant because of the language barrier. And obviously Google Translate between the nurse and the patient isn't making it clear that they're on a dialysis machine versus having an actual transplant. So I was just hoping that the funding for social determinants can address some of those things, as well as what's still broken in the community. So thanks.
Ben, I don't know if you want to answer first or I can jump in.
You can go ahead first.
Yeah, I mean, so Patrick, you raise, I think, a really, really important issue. You know, one of the things that we at AKF have been working on in conjunction with congressional sponsors is the Care for All Kidneys Act, which really is going to drive a national action plan. The intent is to bring all the key stakeholders together to really address health disparities that are unique to kidney disease. I think you raise a really good point about language barriers and the need to sort of raise awareness that, you know, there are many individuals in the immigrant community who have trouble accessing traditional health insurance and may not be eligible for programs like Medicare and Medicaid in this country. And how do we ensure that they still have access to transplantation? You know, I think that's one of the really important reasons why I think having AKF here to help provide charitable premium assistance so that immigrants do have options for affordable coverage where they can, you know, keep their kidney disease, their end-stage renal disease under control and potentially, you know, get to a place where they're in good enough health where they can move up the transplantation list. Ben, I don't know if there's anything else you want to add.
I have a question. I don't mean to interrupt. Can you all
Sure.
hear me?
Yeah, I can hear you, Leanne.
Okay. Leanne Saylor in Louisville, Kentucky. I primarily work with kidney transplant recipients that are waiting on a kidney, and I help them find a living donor. I'm running into a problem right now that I'm starting to see more and more. He is an immigrant that is not legal yet. He's in the process of that, and it's holding him up from being able to qualify for the right Medicaid or Medicare to be able to get a transplant. He's out in California, and all he has is Medi-Cal. And until we get him legal, that's the only thing that we can get him. And it's limiting him to, we're trying to get him transplanted at another transplant center where it moves faster. It's got a shorter list. And I'm just wondering if there's anything in the process that's working on helping these people that are in the process of trying to become legal citizens.
That's a great question. I'm not aware of anything specifically for those who are sort of in limbo waiting for legal status. I think the one thing it's important to flag is there is a lot of focus on making sure Medicaid is expanded in those states that have not yet expanded Medicaid for childless adults. You may recall that earlier this year, Congress enacted a piece of legislation, America's Rescue Plan, that provided 100% federal match to states as a sort of an incentive to, actually it was more than 100%, it's 105%. We're basically paying the states to set up Medicaid programs in those states that haven't yet done so. At the same time, there's a lot of talk about, finding options for those individuals, who reside in states who are never going to expand Medicaid, no matter how much incentive is put on the table. And that is what is being discussed for this next reconciliation bill.
I call all of my local senators. I'm trying to get guidance any which way I can, because this guy, it's the only thing holding him up. So it's just kind of tugging at my heart.
It's a tragic situation for sure.
All right, Sarah, we have a question from Holly. If you think any more states will expand Medicaid?
Yeah, I think that's very much in relation to the comments I just made. I mean, I think there is definitely a possibility that we may see a couple of states. I mean, Missouri is now finally moving forward with their Medicaid expansion, as I understand it. Oklahoma just moved forward with their expansion earlier this year. The new CMS administrator was out in Oklahoma to sort of celebrate that moment. I know the state of Nebraska is moving forward, but there are, I think, about 12 holdout states that have yet to expand. There have been a number of state legislative efforts in states like Kansas to try and push the governors to move forward with expansion. We'll see if any of that bears any fruit, especially with these new incentives that are on the table. I know we have a new CMS administrator who's really eager to work with states to find creative ways to encourage them to move forward with expansion. But I think the jury's still out a little bit on whether that is going to be successful, which is why you're hearing Democrats talk about a plan B, which is finding other ways to cover those individuals until these states decide to move forward with Medicaid expansion. And I think the solution that's most likely to move forward in this reconciliation package is allowing those individuals who would otherwise qualify for Medicaid if they lived in a Medicaid expansion state to be able to buy into the exchanges and get really generous tax credits and cost sharing reduction subsidies to be able to afford their care.
And then Holly also says, how likely is it that Medicare will expand to include dental?
So there is really strong commitment, sort of across the Democratic caucus in both the House and the Senate to expanding dental, vision, and hearing. I mean, at the end of the day, these, members of Congress in this bill are going to be bound by what offsets they have. So that's where they're going to be limited in terms of how much they can include in this bill. But by all accounts, what I'm hearing is, no matter what, regardless of how many offsets they have available, they want to move forward with expanding Medicare, vision, and dental. It's possible it may be time limited in some way. They may be able to only, include this benefit for 5 years. But the expectation is that if they're able to get this up and running for 5 years, that the constituents who are enrolled in Medicare are going to demand of a future Congress that those benefits be continued, which is similar to the experience we've had on the creation of other benefits.
And so what do dentists think of this expansion?
I mean, I think the dental community, by and large, first of all, I think they are delighted that, there's going to be, in what will essentially be insurance coverage for a lot of Medicare beneficiaries who otherwise really are unable to afford even, sort of your basic annual teeth cleanings, much less more serious dental work that needs to be done. I think there are some open questions about what the payment rates will be, and we may see some discussion around that in the coming weeks and months as this bill is making its way through the process. But I think there's a lot of interest in finding a way forward to be able to cover this population.
Thank you. And does anyone else have any questions or comments? If you want, you can just chime in, or you can put it in the chat. No? Going once, going twice. Not, then I'd like to thank Sarah for taking time to join us in the Zoom today and providing all of us with this great and thorough update of what the outlook is for the rest of the year. And Sarah, you're welcome to join us for all future Zooms as well. You're one of us now.
Thanks, everybody.
Thanks, Aaron. Okay, and I'll go ahead and I'll just discuss advocacy stuff really. And I will say I did forward the link to the Zoom to several folks. So I tried to change people's names, but there's another Ben Shlesinger in the chat who is not me. So eventually we'll figure out who that one is. Leanne, I changed you from Ben Shlesinger to Leanne Saylor. So we do have a bunch of different advocacy opportunities coming up. And I say also, through various education and awareness campaigns and other program initiatives that we have, we're often looking for ambassadors to help share their stories. And, if there's an interest in learning more about participating in stuff like this, please let us know. And especially of interest is when folks have been diagnosed with a rare or genetic disease that has caused their kidney disease, because that tends to be where a lot of the interest in speaking to those folks is, because those are less common ways of folks getting kidney disease. So there's a little bit more interest in speaking to folks with those kind of stories. I will say also, like I plug every month, we're still doing the in-district phone calls. Even during this meeting, I've been hearing back from a lot of offices, so we're trying to get through as many as we can. So that's Charles Rice is the other Ben Shlesinger there. Sorry, Charles, I missed you there. And Jim, yeah, I think Peekaboo might work. But so if opportunities arise, we'll definitely reach out. So if there are folks here who have not done in-district phone calls with me, please let me know. So the way we do it is we've done the ambassador's House member and then the 2 senators. But as we've worked our way through the calendar, we've made considerable progress through the Senate. I mean, we're up to, I think, 71 total meetings now. And out of all the offices I've heard back recently, we should be pretty close to 80 soon. So unfortunately for some folks, we haven't been able to do that. And in states where we have a lot of ambassadors, for some of the Senate meetings, I have tried to do the meetings with folks who maybe have not done as many meetings as other people have before. So we will work on that. And Clea, I see your message. I'll definitely reach out to you and we'll work something out, trying to find a way to do a meeting. And just want to reiterate that these in-district meetings are very important, because I think folks tend to forget that there is district staff. When you think of a member of Congress and you think of their staff, you think of the folks on the Hill. But the people in the district office are the ones who are dealing with the constituents and the constituent issues every day. So it's very important, one, for them to just know about the American Kidney Fund and know the different things that we do, and two, just to see how we can help the constituents. Because I mentioned this before, we did a meeting with Senator Sinema's staff in Arizona, and they said they love us, and they send constituents to get not only just education from us, but also they've sent some folks to get the financial assistance from us, the charitable premium assistance. And it's great to hear that a Senate office knows about us, loves us, and is sending their constituents to us. Because for those of you who have been able to take advantage of the charitable premium assistance, you know how important it is. And we just want to make sure that everyone gets a chance to do that. Anel has asked here if there's any state level meetings. Not really. We only did a handful of those this year, and we really only do the state meetings when there's legislation going through a local state house. So I know we did some in Oregon. We did Colorado. I forget what other states, but there weren't that many this year. And we've done more of it in the past, but because of COVID-19, a lot of the state house sessions were cut short, and they tried to speed legislation through as much as possible. Which is good and bad. So it didn't allow us a lot of opportunity to even try and do advocacy, because Melanie and Lindsay work super hard on the state level legislation, and they might hear nothing about a bill for a long time, and then all of a sudden they hear, okay, we're going to have a bill hearing on it tomorrow morning at 10, and that really doesn't give us enough time to get ambassadors, if they're even allowing people to testify or submit comments. So when the opportunities arise, we will definitely reach out. And to echo Holly's comment here in the comments, we did a lot of state work in California in 2018 and 2019, but not much since the pandemic. But it just remains to be seen how advocacy will change. Fingers crossed next year, once the pandemic is under control, because the offices have been very eager and willing to work with us over the phone and Zooms, but I don't know how much flexibility they'll have to do that if they have to deal with people coming into the office, and also people trying to do meetings over the phone. So there will be opportunity, and I think it's always important to try and be as flexible as we can, because 2 years ago, I never would have told you, or I never would have guessed that we would do, by the start of August, 70 some meetings over the phone. I just, never would have thought that staff would be interested or that ambassadors would be interested. But, we've been presented with this opportunity to rethink our advocacy a little bit. So I'm glad to sort of roll with the punches and continue working with advocacy with all of you. So anybody have any questions about any advocacy opportunities? If you are interested in doing these in districts, you haven't done them yet, please drop me a line, and I'd be glad to work with you on that. Right, and I think this is a good time to end this ambassador briefing. I will just end the recording, and then we will do our sort of off the record Q&A after this, just so people can have a little bit more privacy if there's any questions they want to ask. So please let me know if you guys have any questions for in the Q&A, and thank you everyone for joining us today.